Welcome to my community analysis for Holiday Florida. Holiday Florida has geographical boundaries with Tampa Springs, Unclosed, and Beacon Square. It's located in Pasco County and very close to Pinellas County. It's a small community with only 24,311 people. Pasco County is located on the Tampa Bay area of the Gulf of Mexico, and it was founded in 1887. Holiday is a small community that has beautiful natural resources to offer to its residents. Families looking for a quiet near the beach place should explore this community. While conducting my windshield survey, I was able to appreciate the relaxed atmospheres, the beach style houses, and its closeness to the beach. The houses' prices are more affordable compared to Tampa. I was able to get inside some family house in Holiday, and although the space is limited, the houses are well divided and designed. The way that the community is structurally designed offers many advantages to its population. The community is really close to the beach, which is a great feature of this community. Many houses have a gorgeous water view. They are small but very well distributed inside. The area that I visited seems very organized. I did not notice any agglomeration of people or objects on the backyards. Most houses in Holiday follow a beach style pattern. They're small, with two bedroom and one bath, and that's the norm for the houses in Holiday. Houses are cheaper compared to Tampa. Roofing seems simple but appropriate. Floor insurance is mandatory if you pay for house mortgage, and many neighbors of the part of the community that I visited seems to disagree with this regulation. Houses need some improvement and renovations. They're not well painted or ornamented. Inside, the same problem was observed. The houses I saw has to be completely renovated. Holiday Florida has many places for people to go worship. The downside is that they are mostly Christian based. While this can be a benefit for Christian believers, it can feel isolating and discriminatory to people with different belief systems. There is a place called Kingdom Hall of Jehovah's Witness and a Catholic church called St. Vincent de Paul Roman Catholic Church. They offer many services to the community, like food and clothes for those in need in the community, and they also offer monetary help to the population. From a windshield survey, transportation in Holiday seems to be adequate and safe for the community. Signalizations are appropriate and well kept. US 19 is the main road that crosses Holiday, which has great signalization and good driving conditions. Traffic lights are all properly working and streets are clean. Most people own cars, but public transportation is also available. Taxis are also another transportation option in Holiday, Florida. But taxis first can be expensive. Uber, Uber is also active in Holiday with cheaper fares than taxis. Many options for good quality food are available in Holiday. I was able to locate a Publix, an Aldi, and a Walmart in the area where I was doing my windshield survey. These two food stores have a great variety of food and prices. Publix can be more pricey than Aldi, but it has fresher products and many discount coupons and offers daily. Popular pharmacies like Public Pharmacy, CVS, Winn-Dixie are available in Florida. These pharmacies offer drive-through services, a wide range of over-the-counter medications, and health screening services. Holiday Florida represents a small portion of the Florida population. A 9% reduction in the population was observed from 2010 to 2016. The majority of the population are older adults. People 50 to 54 almost double the younger adult population aged 20 to 24. The predominant race is white, which compose 89% of the population in Holiday. Compared to the state and the county, Holiday, Florida hosts a small number of master graduates with only 528 people as of last census. An interpretation of this community population can yield some interesting data. Holiday population is an older population that is retired or close to retirement, which contributes to a minimum economic growth. The employed people of Holiday only make up 44.6% of the population. From the small amount of people holding a master's degree, we can conclude that most people in Holiday does not have a high rate of education and income. Diversity is not strong in this community with such a high number of whites. By driving around the population, you get the impression that this community income bracket is lower compared to other places in Pasco County. Live births are by far more frequent than deaths in Pasco County. Health concerns for holidays are number one, chlamydia, which has the highest incidence of all STDs in holiday. Holidays follows the same trend as Florida, where Floridians between the ages of 15 to 24 represent only 13% of Floridians' population in 2015, but accounted for 64% of reported cases of chlamydia. Gonorrhea is also highly predominant in holiday. Gonorrhea can cause serious infections, infertility, and ectopic pregnancies. Pregnant women can infect their fetus if they have gonorrhea. Due to the high incidence of gonorrhea, pregnant women are a section of the population that needs education, early testing, and monitoring. Heart disease is the number one leading cause of death in Florida. National statistics recognize that heart disease are the leading cause of death of the whole nation. Half of all adults have one or more chronic health condition, and 1/4 of adults have two or more. Heart diseases have become an epidemic in the last decades. The rise of obesity among all ages of the population and the adoption of unhealthy lifestyle habits have contributed to this health concern. Cancer is the second leading cause of death by only a 0.04% less prevalence than heart disease. Cancer can also be in part attributed to unhealthy behaviors and obesity. In many types of cancer, early detection is key to survival. For example, Florida has a low colon cancer screening statistics. Health services in Holiday, Florida are appropriate for the population. Hospitals like Florida Hospital of Pinellas and Medical Center of Trinity offer many services. They have retirement and nursing homes that are available with nursing services, recreational services like hair and nail salon. Mental health services are also accessible and appropriate for the population. Urgent care clinics are available for holiday residents, and they're affordable and competent. Social services are appropriate for the community. Programs like Youth and Family Alternative, the Salvation Army, Pasco Pregnancy Center are available for the community. My number one objective from Healthy People 2020 is to reduce coronary heart disease. Helpful interventions and resources found in Healthy People 2020 are screening, digital blood pressure monitoring education, risk factor screening, and this objective is applicable to my community because cardiac disease are number one leading causes of death. My second objective is to reduce the overall cancer death rate. Cancer death is the second leading cause of death in Holiday, Florida. Programs like cervical cancer screening, breast cancer screening, colonoscopies, and counseling can go a long way to prevent cancer. Because of the high incidence of chlamydia in Holiday, my third objective is to reduce the proportion of females 15 to 24 years with chlamydia infections attending family planning clinics. Programs like school-based education about STDs, appropriate immunization programs, and screening for sexually transmitted chlamydia can be helpful interventions for my community. For the environment, it's safe and has good quality water supply. It's supervised for safety and quality. The air quality is excellent. Pasco County Mosquito Control offers services for my community, education to control the growth of mosquito population. Opportunities for recreation are multiple, and Holiday has beautiful natural parks for families and individuals to enjoy nature. Law enforcement and fire rescue serve the community effectively. Topics of concern for the community is mosquito control and flooding and insurances. Um, Holiday, Florida is surrounded by water, and mosquito control efforts are sometimes not enough for this community. It is hard to control mosquito growth in this zone. Government official contact information is accessible to the public. Residents were not able to remember any meeting held recently, and the budget for Pasco was easily found, but not the budget for specific for holiday. My number one concern for my community is heart disease. This is my priority because heart disease are taking a big health toll in this community and are highly preventable. Cancer is the second leading cause of death by only a small percentage. Cancer is also a big factor in the mortality rates of my community. Community health education needs to be provided in regards to screening, risk factors, knowledge, and healthy lifestyles education. STDs are of great concern for my community. Many young people are being infected daily with big repercussions to their health and future family plans. College fairs and university outreach programs need to be implemented in Holiday, Florida. The community needs information and motivation to increase their educational and income level. Inclusion of diversity needs to be promoted within this community, since the community is mostly white. Cultural education and awareness programs are important for this community. Lastly, Holiday, Florida is a small community with not much popularity. This community can benefit from financial growth. Thank you for listening to my presentation.